Hi, I'm Dr. Ryan Hooper. I'm a board certified clinical psychologist practicing here in Chicago. And yeah, I'm very excited to be back this week. Last week, I watched episode 1 of 16 and Recovering. This is a show based out of Boston, Massachusetts, where MTV is following a lot of teenagers at a recovery high school. Being in a recovery high school was fairly new to me, but I do work with a lot of young adults and older adults who are trying to recover, who are trying to save their lives from addiction and from mental health. And so I got a lot of great feedback last week about the episode, and so I thought I'd come back and watch some more with you. And so let's go ahead and jump in and see what happens.
People really have no intention of stopping using. We're going to have to start addressing some of that.
Yeah, I'm sorry if I was or came to school up. Staying sober is really hard, but I'm gonna try it.
That's fantastic, Griff.
Just keep pushing each other to stay clean and keep working. You got staff, you got peers.
As Griff says there, as Griff admits, to the whole group, recovery is hard. It's really hard. I see it every day of my life in the work that I do. For my clients who are fighting tooth and nail to stay clean and sober. And recovery is 100% a choice. And you have to really fight. You have to really try. You have to really put in your effort day after day to make it happen. And so what the principal's talking about here and what the other staff are kind of clamoring about is, look, maybe we're being too lax. Maybe we're just too open about this. We're too freewheeling, and there's a lot of kids here. There's a lot of students that aren't trying, and it's really hard to find that balance. I've seen this a lot because on the one hand, you absolutely don't want to be too punitive. I mean, that's been the history of addiction treatment, is being too punitive, too confrontational. And you just push people away. They don't want to hear it. You're not engaging with them, and so they're not going to try. But then on the other end of the spectrum, you can be too open. You can be too freewheeling, and if that's the case, then there's really no accountability for recovery. And so it's a really tough balance to find, particularly in a community like this, right? Because this is not a lockdown unit. These students are going home every day. They're still living their lives outside of the school. And so these types of conversations are how you try to strike that balance, to help your clients see, like, we are holding you accountable. We're seeing what's going on. We're seeing the drug tests. We're seeing that you guys aren't showing up clean at any point. And so this is how we have to pull everyone back together.
Students come here in all phases of their recovery. Some of them are willing to stop, some of them aren't. And we know how complex that is. And we know that their brains are going to be wired a little bit differently. All of us, we have breaks. We go, oh, you know what? I'm going 90. I should probably slow down. As a teenager, I didn't know the meaning of slow down. You're bulletproof, right? And then as soon as you add substances to that, it's almost like they become addicted before they know they're addicted.
The principal's making a good point there, and I just want to talk about that just a little, which is, from a neuropsychological perspective, we know that the human brain continues to develop into the mid-20s, right? So it doesn't really stop developing until probably about 25 or so. And so, the area that is the slowest to develop or takes the longest to develop is the frontal lobe. And that's the area of the brain that really has to make those difficult decisions about stopping. Like the principal's saying, when an adult is going 90 with a fully functioning brain, metaphorically, they can decide, this isn't working, this is too dangerous, this is too risky for me, I have to stop. But for teenagers, that's a really hard decision to make. And from the research, what we actually understand is that what teenagers generally do understand is reward. So they understand the possible benefits that could come, but what they really struggle with is the risk side of things. And so when you add substances into that formulation, that's almost impossible to overcome, because substance use is so much about reward, especially in the moment for your brain. And so that's an incredibly hard thing to stop doing once you get going. The other important thing she said there, and I've seen this a lot in treatment, is people show up to your door with different motivations. They show up to your door in different states of mind. And so, I've had clients who are dearly desperate and motivated. They've reached their point. They've reached the point where they can't possibly use anymore, and they're desperate. I also have seen a lot of clients who are very much on the opposite end of the spectrum. And so, although at some level they may say, yeah, I don't really want this negative consequence, but does this outweigh the positives of using? Does this outweigh, the social benefits of partying? Does this outweigh how good it feels in my brain to use cocaine or heroin or alcohol? And so I'd have to imagine in a recovery high school that's trying to be flexible, that's trying to be open, that's trying to be really empathic to their students, that's a hard balance to strike, just like we were talking about earlier. And so, the high school has to figure out, what do we really want with this?
I just remember being as a kid not just liking what everybody liked, like sports. I was just a really introverted kid. I loved watching weird cartoons and drawing, and that's how everything started, artistic-wise.
Music and creativity can be a huge part of recovery. And I was talking about this a little bit with episode 1, which is, there's a lot of paths to recovery. And creativity and finding new ways to live your life is often a huge part of that. And there's thousands of ways that you can live your life, right? But you have to find something that really connects with you in a special way. And often when my clients have been living just so secluded and isolated and in their addiction, they really have to try some new things. They really have to experiment. And getting creative and getting out of their phone, getting out of social media and into their bodies and into music, that can be really, really powerful. And that can be really rewarding, and something that just might be rewarding enough to counteract that pull to use and drink. So I love how important art and creativity and music is in this school. And it sounds like it's part of this student's recovery story.
And then I got kicked out by my mom for just smoking too much weed. Then I had to move in with my dad into another house. And then I basically got kicked out of there too. I've used cocaine. I've also used lean and LSD among opioids that I used to eat with my nose. Just really like drugs. I don't necessarily want to be sober forever. I want to just be able to do my own thing.
And that's okay. Particularly for teenagers who tend to be pretty short-sighted. It's hard for them in their young lives to really see the big picture, to see, what their life is going to be like in the 20s, 30s, 40s, 50s. Just seems like a lifetime away. So I don't feel in any way that you have to, whenever you're working with clients in addiction, that you have to be really stringent about you can never use again, because it's about meeting them where they're at. It's about helping them meet their goals. And, as he was talking about there, he just doesn't want his drug use to get in the way of his life. And I think that's really important. That's what matters to him. That's what's really meaningful to him, is that he can still play music. He can still graduate high school. He can still find a job and support himself. I mean, he didn't say all those things, but when addiction is really getting in the way of your life, that's what you want back. You don't want clean time or sobriety or recovery just for the sake of it, but you want your life back. And so that recovery is the way that you get there.
I work in addiction. I work with kids who, sometimes I had to work in the gray. Sometimes I gotta pick them up in crack houses and shooting galleries and throw them in my car, and that's unsafe.
So what do you got?
Here's a bunch of cardies.
Okay, so there's there's a lot of ways to be a helper in recovery, and each clinician has to draw their own boundaries. For this principal, you know, as she's saying, she chooses to be in the gray. This is likely part of her own recovery story, her own recovery story of her family and her father. And, you know, perhaps she just has more latitude as an educator to go pick up kids in a crack house. You know, that's not the way that I practice, but, you know, there's a lot of different ways to help. And so, you know, she's really putting herself out there. That again shows you how much she cares about her students, how devoted she is to helping these teenagers recover. And, you know, if she doesn't do it, if she doesn't go save them in that moment, who will? Maybe nobody. You know, the flip side to that is, you know, you can go too far. You can put yourself at risk. You can possibly enable your students to continue their use. Now, let's talk about that word enable. I mean, that's an old school kind of AA word, Alcoholics Anonymous word. When family members or friends would bail people out of their addiction. You know, so someone is down and out, and you give them the money, you kind of patch them up and you get them back to their life, and then they start drinking or using again. Now, there's definitely some truth to that, because if people aren't experiencing the natural consequences that come with addiction, they may never stop, right? So if they keep getting patched up and patched up and patched up, and their family member keeps taking them back and taking them back and taking them back. And I'm not necessarily even talking about teenagers. I mean, I'm talking, you know, I have clients who have spouses or partners who have been supporting them through their addiction for decades. And, you know, not even someone that's had, it's not like someone that had, you know, 5, 10, 20 years of sobriety and then relapse. That's not what we're talking about. You know, I've seen clients who have had days or weeks of clean time, and then they relapse to a lifestyle of addiction, and that family member is right there to pick up the pieces again and keep them going. And so, you know, I try not to subscribe too much to this idea of enabling, because it's a balancing act. And there is a way where if you push people away, if you push away your family member or loved one who's trying to get clean and sober, who's trying to recover, and they relapse and you push them away, then you may not be there when they really are ready to get help. So it's a really tough balancing act. So for the principal, you know, I can imagine that there's some times when she goes into that gray, when she goes into the crack house, when she goes into a shooting gallery and saves a student from that, and maybe she saves their life. And because of that, they can come back once they're clean and sober, and they can talk about, okay, what now? What steps are we going to take now so that that doesn't happen? How can we hold you more accountable? How can we get you more treatment? And that's my hope. You know, that's my hope, that's how her students perceive how willing she is to really go the extra mile to help. So it looks like she's talking to a police officer here. Let's see what happens.
And what we do here at North Shore Recovery High School, they expect every child here to adhere to what they believe recovery should be, and not what we all know recovery to be, which is they're trying to figure out their path. They're trying to create a space for themselves where they fit in this world, and they're going to relapse.
That's hugely true, which is, I mean, so she said, for the reality, we know, you know, those of us that work in recovery, that there's a lot of ups and downs. And that's true. I've seen it. And then you add on to that these are teenagers, right? With a still developing brain, with still trying to figure out who they are in this world, right? Trying to transition from child, teen to adult. It's incredibly hard, incredibly challenging. So I 100% agree with her that this is really hard work for the school and really hard work for these teenagers.
You're unsafe right now. You can't stay in school, so I need to make sure that I'm creating safety with your mom, or mom's gonna bring you to the ER, or mom's gonna bring you to the detox. I don't know what's gonna happen, so I need you to chill right now and stay with me, okay? Because this could end really badly. And I know you're not in the right frame of mind, but I need you to listen to me.
This is good. So for this student, Alex, the principal's saying you're unsafe, right? Again, we see that there are certain students at certain times that just reach a threshold, and I'm not exactly sure what that threshold is, but the student has reached a threshold where it's just unsafe. It's unsafe for her. She could die, right? If she continues to use in this kind of way. And so she's brought in the mom. We can see the mom right here in the room, in the office. And it sounds like they're reaching out to other family members to try to make an intervention here, to try to save Alex from herself.
Night, and she drank to blackout. So I'm really concerned, and I feel like we are at the point where she needs some help. That we can't. It's beyond any of us.
But I really don't give a
So Alex,
I'm leaving.
I don't know. I need you to sit down for 1 second, first of all, because you know what? And this is what I've said from the beginning, and I've always had your back. Okay?
Like, she doesn't act like a mother.
Alex,
Like, honestly,
Alex.
if I were, I'm out.
Sit, Alex. Alex, I need you just to come here for a second, honey, because if not, I have to call an ambulance. I'd rather not do that.
So we don't know what's going on at home here, but it doesn't look good. Alex is saying she doesn't act like a mom. We don't know what that means. We don't know the backstory here. It sounds like mom and dad are separated or divorced. This is not a good situation. The parents are clearly overwhelmed. Alex is checked out. I mean, she's probably intoxicated right now, but she seems exasperated. And even the principal, even the teachers in the high school here don't know what to do. And sometimes this is just the point that you reach in addiction and recovery is we don't have an answer. We don't know what to do. What I do like what the principal's doing here is she is setting a firm boundary here. She's saying you have to do something. You have to make some changes. You have to follow some of the suggestions that we're giving, or else we're going to have to go to the next step. So I do like that. I mean, in addiction, you have to have some kind of a foundation here, some kind of a boundary. And if Alex just refuses to comply and won't even listen, won't even be here as we're talking about her life, then we have to go to the next step, and that may include some consequences. And that's where those natural consequences come in. And, I think she mentioned maybe going to detox, maybe calling an ambulance, which, if it's against Alex's will, is not going to be a great situation, but neither is Alex continuing to go down this path. So I'll be really interested to see what they do.
That she doesn't want to go with anybody.
She's not making any rational decisions at the moment either.
I
But I'm just saying,
completely agree with you.
I don't want it to escalate. I'm trying to find the possible route of least resistance, where she's not going to go completely ballistic, because you've seen it, I've seen it, mom's seen it. If she goes ballistic here, I have to call the authorities.
I've been in those situations. You see everything is escalating. You can feel it, and when you know your client, when they're reaching that final emotional edge. And she says, we don't want her to go ballistic. Now, I don't know what Alex has done in the past, as far as if she's gotten just verbally aggressive, if she's gotten physically aggressive, but as a high school, she still is going to have some boundaries. And she says, I'm going to have to call the authorities. You know, at some point she may have to get the police involved. And I know that's not what she wants, but if Alex is going to hurt herself, if she's going to hurt someone else, or if she's just going to be really unsafe, that's not a situation that anyone wants to be in.
Why don't you come in my office?
You were out of your mind, wasted.
I'm fine.
Just come home with me and we'll wait, and then we'll get some of your stuff together so that if you want to go to Dad's, you can. Maybe take a nap.
I want to go to school.
Well, you can't.
I don't want a bunch of people screaming at me and bitching at me about how I'm a failure and
It's hard to see, you know. Like I was saying, there just seems like there's no answer here. Alex doesn't really want to face reality. You know, she doesn't really want to face consequences here for what's going on. You know, she just wants to keep moving forward with life. I just want to go back to school. But, you know, everyone here with her, her parents, the principal, knows that this just isn't working and something has to change. And Alex just can't quite hear that right now. It's hard to see.
You messed up. I'm giving you the break of a lifetime right now. The break of a lifetime. Because you're gonna wake up out of this fog and you don't wanna wake up in detox right now. Okay? So do you understand that? So what you're gonna do is you're gonna try to hold on as much as you can. If you can't make it, you're gonna call or text me and we'll get you into detox then.
So this isn't a terrible idea. I mean, you know, she's kind of gone to this certain boundary that we've been talking about, but the principal is still trying to be flexible and seeing that Alex just isn't budging. She's trying to find the easiest way, like she was saying earlier, to help her. One question that just comes up, you know, in mind for me is money, is cost, because detox is not cheap. Detox is not cheap. And, you know, from a physiological perspective, you know, these students probably don't need detox. You know, detox is primarily in the treatment of withdrawal, which is when someone has been using so much, so frequently that their body has adjusted. Their new homeostasis point, their new base point or foundation is high. And so when drugs or alcohol aren't there, then their body freaks out and they can have physiological reactions, such as like seizures would be kind of the worst case scenario with withdrawal. Or it can just be really uncomfortable or painful. It's unlikely that these students with the type of use that I'm guessing that we're talking about here would need that type of detox. This is probably just an effort when we're talking about detox to get these students back to baseline, like kind of a reset. So the question of cost just comes up. You know, I'm not sure if these families are footing that bill. I mean, you know, one day of detox could be thousands of dollars, tens of thousands of dollars, depending on the setting. So that definitely raises some questions. Not that the principal would get that money, but with these families who look like they could be struggling financially, you know, those are big decisions to go to detox. So really understanding what is the full cost of this going in. So for Alex specifically, the principal is kind of giving her one more chance here. I don't think it's going to work. I can't see Alex, you know, snapping out of this and making a huge change, because we don't really see anything changing. There's no plan in place. We're not seeing the whole picture here. We're not seeing behind the scenes. So maybe there's some incredible CBT intervention happening, but that's what I would like to see here, is to really talk about maybe a behavior chain analysis as far as what were the decision points that got her to where she's sitting out now, and what can be different tomorrow? What kind of coping skills can you use so that we're not sitting back in my office having the same conversation tomorrow? So we're not seeing that. I don't know if it's happening behind the scenes or not, but I'm worried. I'm worried for Alex.
Am I harming?
No, 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 you're not harming anybody, but you're under the influence and it's triggering to other students. You can't be like this at school, okay?
This is like my safe place. I hate being at my house.
I know, honey, but this isn't safe if you're under the influence of something, okay?
People come here who are desperately sick. They wouldn't go to their regular schools like that because they know that the regular schools would treat them like they're bad.
We see a little bit of a fast forward there. 2 days later, Alex enters an adolescent treatment facility, which was probably what had to happen. As I was saying, Alex just wasn't making the changes that needed to be made, and she was going down a scary path. And I was also just kind of feeling in that moment, reacting to how disconnected she feels from her mom. We don't know the backstory, we don't know what's happening, but we can see that at least in this moment, her and her mom are just fractured. And the contrast of that, the counter to that is how close Alex feels with the principal. You can see that they have a real connection there. So I'm sure this is part of her struggle. This is part of her addiction, is that broken relationship at home, perhaps the broken relationship with her parents, and how that's led to her, or at least been a part of her addiction.
And we'll do one more. On the count of 3, 1, 2, 3. Big smile. You're good to go. Turn your head to the camera. So nice and tall. And bring your hands in a little bit. Yep. And then tilt your head just like that.
Yeah, it is.
This thing over with.
I really love this. I feel like so often for people who are sick with mental health, who are sick with addiction, that the normalcy of life gets stripped away. They're in a hospital-like rehab setting. And what I love about, a lot of what this high school is doing is they're still trying to keep the normal kid things happening, the normal high school things happening. So, we saw prom happening, and this week we're seeing picture day, and that's important. That's important to still keep life moving, so the kids don't feel like they're just falling so far behind, or feel like they're not normal. So I really love that they're continuing these traditions.
I don't like people who are like the same as everyone else. And that's what I do like about this school. Everyone's like their own character.
Each kid, if you have 42 or 48 children here, students, you have to learn. Each one's different.
What? Paul don't got it no more.
That's powerful. The last thing that teenagers want is just to feel like everyone else. Just to feel like they're an uncared for, number in the books. And so you can see that this school is doing a great job of making the students feel special. And, even the teachers, social workers are talking about that we try to build relationships with every student here, and we try to maintain those relationships. And having, such a small school setting, like 50 students, 75 students, that's still doable. So that's really encouraging. It's a unique strength of this place.
Anxiety's just always through the roof.
It's a lot of feelings coming out at the same time. And you sound like you're kind of hurting and confused.
I would have never thought.
I'll just pause for a second here just to talk a little bit about the letters that we're seeing next to this counselor, just in case you're not familiar with those. So we saw, I believe, MSW, which is a Master of Social Work, and then LICSW. So this license changes from state to state, but I think what that likely stands for is Licensed Independent Clinical Social Worker. So he got his Master's of Social Work, and then he went on to do all the requirements that he had to become a licensed clinical social worker in Massachusetts. So that's really great. I mean, he has great training. I work with a ton of fantastic social workers, and psychologists and psychiatrists and addiction therapists. And that multidisciplinary team is a huge part, and we have more. I mean, chaplaincy, pharmacist, recreational therapists, art therapy. I mean, that huge team is a part of what really makes the difference, because there's so many ways to connect with clients, and addiction is so challenging that you really have to have a whole well-rounded approach to meet all the needs of your clients. So we see the principal, who has an incredible amount of clinical skills, but we also see that she surrounded herself with licensed clinicians, like the social worker we see.
In 100 years, I ended up being coke snorting, Molly popping, token kid. I'm 16 years old and I look like I'm 25. You know what I mean? It's not how I thought I'd be. Every day I can't get away from it, everything. I wake up and my mom's talking to my psychiatrist.
I hear that a lot, that this is not the life that I envisioned for myself. I mean, no one ever envisions becoming addicted, right? That's not what they want for their lives. And Joey, sees that already, right? Here he is, just at 16, and he's on this path that he never envisioned for himself, and quite frankly, he doesn't want. To be using drugs, to be in a recovery high school, it's contradictory to who he sees himself being. And I think that's really important to talk about. That's a really important contrast to draw, because the only way to ever get back to who you do want to be is to talk about it and to see how far away from that you are. And of course, you can never backtrack, right? You can't erase what's already happened, or where you're at, or who you are today, or where you are today. But you can transform into the person that you want to be in the future. And so Joey is having a really important conversation here, and I'm glad that he's talking about it.
And that's what's great about the recovery piece. Everywhere you've been, everything you've done, everything you've gone through, when you're recovering, it all starts to get better. Slowly, slowly, slowly. But there is light at the end of the tunnel.
Are you in recovery?
Yes.
How long have you been in recovery for?
When I was roughly your age is when I started.
That's a question that I get a lot, because there is this huge history in addiction recovery that is kind of unique to addiction recovery, where it was people in recovery helping others, addicts helping other addicts. I mean, this comes out of the history of addiction treatment in AA and NA. So really long before there was successful clinicians treating addiction, AA and NA were out there, and one addict to another, helping each other recover. And so we see this a lot in addiction recovery, that people who have cleaned up their life then want to give back. They want to go to school and get their bachelor's degree, to get their master's of social work, to become a psychologist, and to give back and help others the way that they were once helped. So this is a question that I get a lot, and I'll tell you, I'm not in recovery. I haven't walked that pathway. My own unique story in getting into into becoming a psychologist and working with addiction is just that I loved the work. I really loved the work, and I loved the people that I was working with, and how hard they were fighting day by day to save their lives. And that was something that I wanted to be a part of. I wanted to help. I wanted to be a part of their story. And so that's, part of what graduate school was for me. That's part of what my internship, my postdoctoral fellowship was, and now the work that I've been doing for 10 years in the recovery field. So, so having people in recovery helping others in recovery is a huge part of that. And so I work hand in hand with, for example, in some of the hospitals that I've worked in, they're called peer support specialists, and work hand in hand with them to enhance the work that they do, and they work hand in hand with me to help in the work that I do.
You know, it's a tough place to work. This isn't just teaching. You're saving lives. You make an impact on these children that lasts for the rest of their life. And my staff know that. And they show up every day with their armor on. Hi, honey.
Bullshit.
The thing about starting a school is that you have to be responsible for everyone that you hire.
I love this school though.
Oh, yeah.
It's That's pretty funny. Yeah, you got to be able to roll with the punches. So I don't know why that student walking by was cursing, if they were cursing at the principal or what. But yeah, some days you just have to throw up your hands and laugh and roll with the punches, like I said. Because the work that they're doing, the work that I do is hard as hell. And, you know, if you're not able to... That's funny. And we see a picture right behind him that says, "Hey, where are you supposed to be?" That's funny.
I wanted to wait till he was doing better. Yeah, I know. All right. Still have a school to run.
I've seen that too. I've had clients die. You know, thankfully, I haven't had any of my active clients die. You know, while they're actually working with me, but I have had former clients, kind of similar to what happened here, and clients that I worked with multiple times, that, you know, somewhere along their path, they didn't make it. And, you know, there's a lot of factors that can play into that, but especially when you're using opioids or cocaine, it can be incredibly dangerous. Because all it takes is one bad hit, and that's it. It may not even be on purpose at all, and you're gone forever. And so that's a real weight. That's a real weight on your shoulders that you have to, you know, walk into work with every day, and you got to be able to deal with it. You have to be able to withstand that. And like she said, we still have to run a school today. You know, because I'm incredibly sad, or because one of my past students died, I can't just leave. I can't stop working. I can't shut down the school. And so that takes an incredible amount of resilience. That takes an incredible amount of self-care. And that's really important too. And there may be days that you can't be there, where you need to take care of your own stuff that's going on, or to give yourself time to cope with what happened. And that was a really touching moment, you know, when those teachers holding hands, you know, just sharing a sweet moment reflecting on that student's life. And so that's self-care in that moment, you know, and that's what it takes.
I'm just not happy all the time. I mean, it's kind of hard to explain. I don't like being caged into one thing or just one place. And when I feel uncomfortable with something, I get up and leave.
So for him, as we can see, you know, music can be a savior and it can be a trigger, right? So earlier, you know, him being clean and sober in recovery, playing music, you know, that's something that may be his pathway to recovery. But we can also see that music can be a huge trigger for him. He's going to a concert, he's using LSD, he's using other drugs. And so, you know, something like music can be a two-sided coin. You know, it can be a savior and a curse too. So that takes a lot of awareness to understand that about yourself, that hey, I may not be able to go to a concert for a while. You know, or I may not be able to go to this type of music because that type of music connects with me in a certain way. Or if I am going to go to this concert, I have to go with a recovery buddy, or I have to have a plan to keep me clean and sober. So those are the type of steps that it takes to really make recovery work.
Good morning, Alex. At
Yay! Oh, I missed you so much. I'm so glad you're back.
So yeah, going back. That's good.
Yeah, I feel like a lot better than I did. And I look a lot healthier than I did.
Yeah, you do. You do.
In the past year and a half.
Wow. Yay! Alex is back. So she's been away for a month in treatment, and she's back at school. So that's a long time, right? So essentially she probably went away to some type of an adolescent addiction recovery program, right? A lot of those programs are anywhere from 21, 28 days. And here she is. She's coming back from one of those programs and returning to school. That's very exciting.
I've been through a lot of rough because of drugs.
So, Alex,
Yeah.
you left treatment on Saturday?
Yes. On Saturday.
And how many days sober do you have?
I have 33 days sober now.
Wow.
I know.
We've been here a couple times now. How is this going to be different?
I can't go back to doing what I was doing, or else I'll die.
Death type experiences are what can really wake people up to how serious this is, and that my use isn't just a joke. It isn't just something that I do for fun and life's a party, but this is something that can and will kill me if I don't change. And you can really hear it. You can hear it in Alex's voice here that I don't see a desperation from her. Probably because she's had 33 days, but it sounds genuine and it sounds real that she wants to be clean. This is something that she does want. And I'll also say, it looks like her and her mom are a little better connected. She's been at this rehab program. She probably hasn't really been with her mom. But as they sit here today, Alex being clean and sober, it seems like there's more of a connection there, which is really encouraging.
Well, she claimed that she did drink it. She just didn't drink a lot.
I just said that there was some in a bottle, and I took a little sip. Okay, so yeah, I did.
Okay. So, I'm really worried about Alex.
Mm-hmm.
Are you too?
Getting there, yeah.
So this is a really good intervention because, it seems like a lot of the time in this school, things just kind of build up. It's like a slip happens, weeks of use, and then it's like we hit this breaking point. But for Alex here, she had 2 months sober, and then she had one slip and they're intervening. So that's really great. That's a great way to intervene before it becomes a slippery slope. And so if she has 2 months and she had 1 month in rehab, that means that she had, about a month in school before slipping up. And, they're able to intervene here so that Alex can cut this off before it goes further down the hill.
My mom has breast cancer. I just didn't want to face it, so I just kept getting high. Trying not to think about it, just distractions on distractions.
So you do realize when you leave like that, mom doesn't know if you're coming back.
I just don't think ever. I used to be happy.
We got to get you back to happy without drinking.
Alex's mom has breast cancer, and that's incredibly scary, right? Because she doesn't know if her mom's going to make it through that. I don't know where she is in the process of seeking treatment, but it's really scary to think about her mother's death. Even if they have their own conflicts, we can see that she does really love her and care about her. And so because of how scary that is, instead of seeking out therapy and talking about it and getting the emotional support around it, it's a lot easier to use. It's a lot easier to drink around it, to forget. And so this is something that I see a lot. And, she's going to have to find new ways to deal with these things, because life is still going to keep coming, and her mom's situation may get worse too. We don't know. But she was just saying, a few minutes ago about how she knows how dangerous this path is. If she keeps going down that hill, that it could kill her.
And fentanyl, it basically was a big downhill spiral. I heard that like each run gets worse than the first or the last one. And for me, that's definitely 100% true. It did.
We are seeing this over and over again. People are thinking it's okay to smoke a little bit of weed, and then 2 weeks later, they need a detox. It ends in handcuffs and jails and institutions and death. That's how it starts.
Joey's in a bad place, right? So now we know that he was living on the streets. He has decided to come back, which is really great, but he's on probation now. So we don't know exactly what happened, but I suspect that he already had some legal issues, and because of this, right, he has more consequences with it. And he doesn't look very healthy. He doesn't look like he's in a great place, but thankfully he's alive, number one, and now he's back. So we don't know the end of the road, but what I've seen is that recovery works. It does happen. There are a million setbacks along the way, but as we saw, right, Alex graduated. She changed her life. It may have taken her mother's cancer to do that, but she did it, and she's taking care of her mom, and she's reconnected with her sister. And she's living the life that she wants for herself, and that's really powerful. And so she's graduated. She's looking to go to college, and that's what makes all of this work worth it. When you see that client that saves their life, when you see that client that's living the life that they really want and deserve for themselves, and so that's why we work. That's why we do the work that we do here, and I'm really glad that this episode today is kind of bookended by the struggles of Alex, but then also the recovery story. So we will wrap things up there today. Thank you again for joining me to watch 16 and Recovering episode 2. I had a lot of fun watching this today, and just sharing my own expertise and story, and seeing the ups and downs of addiction and recovery, and just really a lot of incredible stories here. I love to see it because recovery does happen. And, for people who are struggling, unless you see those stories, unless you see people who have had the ups and downs and is still alive today, then you think you may never make it. So thanks for joining me today. I would love to hear your feedback. Love to hear any other ideas or episodes that you'd want for me to watch. And thanks for joining me, and I will see you next time.